And the lights, if you'd like to change the lights at all, those 3 switches over there, the middle one is the one that you change is off right now. Okay, so first up today, we have Jordan and Kat will be presenting on chronic obstructive pulmonary disease. Okay.
So go ahead and find a partner. Yeah. Yep.
So does anyone know anyone with COPD by chance? Yeah, you. Just you? No one else? No. Okay. Well, so hopefully you do well on this. And hopefully maybe you'll learn something new.
Oh, we're sitting down. Okay.
You can turn off all that.
Yeah.
So they can see.
Okay. So go ahead and work through those with your partner and then write the answers on the board.
Be like a shadow third member.
Kind of get you guys involved.
Yes, thank you.
It's a cricket. It's fine.
Oh, must have got out of, it must have defeated this thing.
It's fine.
COPD disrupts.
Okay. I don't have anything. I might have something to put it up for now.
You get it?
Do I have it? There. I
I
got it
got
now.
it.
I have a baggie in my backpack. There's a cricket. There was a
No,
cricket.
I don't think so.
Oh, sorry, I was just.
What? No, I wasn't pushing. I was helping. Okay, I didn't know where they were hiding. No, you've got 40 minutes, so you've got plenty of time. I just needed to know if I needed to run and get my record.
Like one of each.
Your partner one. 3, 4.
You always need to.
Right. That's the old box.
COPD is reversible. I'm not sure. I feel like even in a tree, we can treat.
But I'm really just basing this out from my grandpa.
Hi, Tess. These are the things that we're looking at right now. I don't know if those are right yet. We will find out.
She'll,
COPD and asthma are the same.
so she'll see later.
Okay.
You were breathing on
Thanks for participating, Tess.
Exercise intervals.
Well, we didn't say one, so if you want.
I have two that I didn't
That's a nice camera right there.
We're breathing masks. Exercise
I've seen a lot of them. Only for old people. This one's snow.
Well, that's good. I wouldn't think.
What about air? Okay, yeah, air. Reversible, is that up there? Okay. Oh, there it is. This one. Breathing mask isn't out there yet.
How are they doing?
Wait,
They're doing pretty good,
Yeah.
actually. Like, really good.
seeing if it's true or false.
So,
Breathing mask.
So shortness of breath is definitely.
Yeah, it's
Oh,
okay.
okay.
Yeah.
You guys are like, you guys are, you raised your hand that you know someone.
oh, no,
A lot of our clients.
I was like, oh, God. I really don't
Oh,
know
I
if I
forgot to ask
did.
this question
What do you
last
think
week
about
when we were talking about
asthma
smoking.
and
Do you know anything about like, there's a statistic we were told at work that like 75% of people who buy tobacco products are mental health, like have mental health issues.
Oh, interesting. I haven't heard that.
At least in the US.
Yeah, I don't know if that's
Okay.
true or not true.
Here we go.
Figure that out.
Yeah, no,
that's
you
what I was
have
like.
to do some digging.
Yeah,
Do it about.
I mean, I can definitely see it because like I've never seen it change, like I've seen it
There we
where
go.
all my clients smoke 4 or 5
Did we
times.
write all of them?
Like
Trying to
just in
figure
my
out what-
8-hour shift,
where
I'm
the
like,
range
holy
was.
cow.
What about the,
Like a lot of times we'll have
I have
clients
one
who
right here.
share
Okay,
to regulate their cigarettes, we'll only give them like 1 cigarette every hour. Otherwise it's just going. That-
Okay, this one, there's one up here.
It's basically where running on stop drinking.
So it's false.
Yeah.
Your body
I think they
can't
have it
stop.
on here, actually.
You have to stop.
Yeah,
A lot of
they
times
do.
it's pop for
Okay, there we
people,
go.
so we have to like do
Yeah.
like hourly weight checks, like intake, and then we have to monitor their.
Okay, we're missing one on this one.
True.
It's, yes, it is false.
And these people like can't.
We're missing one on the true.
It's like we have.
Is it over there?
No, it's not on either of them.
Like, and then like a few times like we've caught him like outside, like making himself throw.
Oh, it's not
He
you.
can take more because his body tells him like, I physically can't.
Oh, yeah, you're
I'm
missing
so
number
thirsty.
15 on.
And you're missing 12 too.
15 and
It was funny.
12.
Yeah, I put that one right here.
Oh, yeah.
Oh, okay.
It's just
Sorry
like,
about
it's something I never
I didn't write it
considered
out
before
because
working there.
that's just too much.
There you go. We're missing one. That's okay. We got it.
Okay.
Can we go through them all?
Yeah.
Good job, kids.
I keep telling people we're looking for
Here comes the
workers if anybody wants a job, but it's not an easy thing.
Oh, well, it's fine. Okay. So did any of these like surprise you guys at all?
Are we right? Is the board all
Yeah, they're all
accurate?
right.
Yeah.
So did
So
you
if you
guys,
guys want to know the answer, sorry.
okay, so did you guide people or did you guys just do this all by yourself?
They did that.
Yeah,
They did
So
that.
there was no, interesting.
Yeah,
So-
they very well.
Carry on.
One of you asked if we could just give you the answers so that you didn't have to go through all of it. So 1 is false, 2 is true, 3 is false, 4 is true, 5 is false, 6 is true, 7 false, 8 true, 9 and 10 both false. 11 through 14 is all true, and then 15 is false.
What it is, wait.
6 and 7 are, 6 is true and 7 is false. Yeah. Yeah, it's not working correctly. Okay, so what is COPD? COPD stands for chronic obstructive pulmonary disorder. It can cause emphysema, chronic bronchitis. It limits your airflow intake, and it is not fully reversible on the airflow intake. It is progressive. You have abnormal inflammatory response of the lungs, and you can get blockage and breathing-related illnesses and like just problems in general with your breathing. And then it's primarily caused by smoking cigarettes.
Can you go back? So like,
Yeah,
what
we're
this
just-
picture was showing. Can't get it back?
Yeah. if I go like this.
Having trouble with the clicker?
There we go. Go to back.
You did good, there. Okay, so what the picture is like showing is like emphysema and chronic bronchitis and asthma all kind of like coexist to make like COPD. It's not like one singular thing. So it covers all of those types of diseases and chronic issues. Okay, so with asthma, you actually, if you have asthma, you are not guaranteed to like develop COPD, but it highly you're more likely to get COPD if you do have asthma because of like all the environmental factors that affect you, like your breathing, obviously. So asthma itself is genetic, and so you can see in this picture what the normal bronchial tube is compared to asthma, where it kind of constricts and limits like your airflow.
So we're talking about emphysema now, and emphysema damages the tiny air sacs that you have in your lungs. These air sacs move the oxygen through your blood, and when you have emphysema, it can't expand and contract properly, so it really restricts your airflow and just the oxygen that you get throughout your body. This can leave large holes in your lungs, which trap stale air, which is not good for you. If you've ever been in a house that smells moldy, you know similar feelings to that. People with emphysema can also have a great trouble with exhaling as well.
So then we come to chronic bronchitis. So this is the inflammation of the bronchial tubes, and also these tubes carry like the air to your lungs, and they can develop like mucousy stuff in there to where it's like clogged up and you like can't breathe. And like some symptoms of this are shortness of breath, wheezing, and chest tightness. Has anyone in here ever had bronchitis? Okay, so I've had bronchitis too, acute bronchitis, and it was awful. So like imagine having that for like long periods of time. Yeah, I could not imagine that.
So we're going to move into the symptoms of COPD now, and a lot of it is breathlessness and coughing. You get progressive dyspnea, which is a difficult or labored breathing. You also can get sputum, which is when you cough up a mixture of like mucus and spit and a lot of other nasty stuff, kind of when you're sick and you know you get that like really wet cough and you try to cough something out. That's what sputum is. Symptoms reported as most severe in the morning. So a lot of the people with COPD, their symptoms are extremely severe whenever they first wake up, and then they get progressively better throughout the day. They don't recover, but they do have a much better life throughout the day than when they first wake up. And a simple test called the spirometry can be used to measure pulmonary or lung function and detect COPD in anyone who does have breathing problems.
Okay, so here's like, I'm sorry, I am in your way. I don't know where to stand. So here's like a picture of when you go to the doctor and they're like testing you with a spirometry, and they can detect like your symptoms before you even know that you have it, and they can also detect like what stage you're at, like lung function wise, like how much you can breathe in and out. And this is also like one that you can like use at home, because you do like breathing exercises to help maintain your lung function. So you basically like breathe in this tube here, and you try to get it all the way up to your goal marker, what your doctor sets it as. And you do this like 3 or 4 times an hour, every hour you're awake typically. So that's a lot to do when you're awake, and to like remember that is really hard. So I thought I would put that in there.
It is kind of hard to get it up.
Yeah, I
Like
used
with
one, and it
with
really,
regular lungs, it's kind of hard to get it up. So imagine like it'll probably only go to 0 if you have COPD.
You guys ever used one of these before?
Yes.
Is it hard to use too? Because that seems really
Yeah.
hard to me.
Yeah, they're really difficult. They just kind of make me blow into it quick.
It's almost like trying to swing the hammer at the carnival. You can't get
Get
the little
yeah.
bell all the way up to the So the rate of disease, I actually used a study for this one that they did in a hospital. In the study, they observed 1,960 patients. 299 of the patients that were involved in the study were pre-bronchodilator, and they reported having a limitation of airflow. 211 of the patients were post-bronchodilator, so they were already using one, and they reported airflow limitation as well. 183 of the patients who were diagnosed with COPD and had post-bronchodilator, 36% of them had mild airflow limitation, 51.4% of them had moderate airflow limitation, while 15.3% had severe and 2.7% had very severe. And then 18.6% of the 1,960 were previously diagnosed with COPD, and all of these, almost all of them, had already had severe to very severe airflow limitations. So some of the risk factors with COPD, if you smoke, that's what the highest risk factor that you can have to create COPD. Whenever you are over the age of 40, it's more likely that you get COPD. Air pollution, that's a big one. So we've all talked about like going green with like green cars and stuff like that. And we are learning that exposure to air pollution is causing a lot of medical side effects to your body. Breathing secondhand smoke, so not even just smoking, like if you breathe in secondhand smoke, if you're around like your parents or your friends who smoke, that can cause COPD. Working with chemicals, dust, and fumes. So chemistry majors would also need to watch out maybe. And then a history of childhood respiratory infection.
And also, one stat that I had seen is that, not everyone that smokes is going to develop COPD, and not everyone that has COPD, has a history of smoking. But it's 8 out of 10 typically that develop COPD from smoking. So I thought that was pretty stat.
Okay, so survival rates of people who have COPD, the third leading cause of death in 2014 in the United States was COPD. And COPD mortality in females has more than doubled over the last 20 years.
It's mostly found in females too, primarily.
Walking, swimming, even bicycling, staying active is an important part of health, especially for patients living with COPD.
It is a progressive disease. Even though it is irreversible, it could be treatable.
COPD limits the airflow in the lungs, making it difficult for patients to breathe. Health experts say 2 things patients can do to manage their symptoms are stop smoking and exercise.
By quitting smoking and doing the exercise, what we can do is alleviate the symptoms and reduce the frequency of exacerbation.
COPD happens when the lungs have been damaged over a period of time, but the symptoms can be managed.
Exercise is a way to control their symptoms getting worse.
Things like Pilates and yoga can help patients with COPD learn how to breathe to strengthen their lungs.
It is good for them to have some yoga. Main problem with COPD is that trapped air is not getting out and it is not replaced with fresh air.
Breathing exercises and aerobic exercises need to be done a few times a day.
With the exercise, they can improve the circulation to the lungs, and it helps with cardiovascular muscles and it strengthens them.
Health experts find the exercises can also help patients relieve stress and anxiety.
If they can do their own stuff by themselves, they are not depressed.
Helping patients breathe can ultimately improve their quality of life. For Lee Health, I'm Lindsay Morton.
So So this is just kind of with everything we've talked about this semester. If you exercise, it's going to improve basically your entire life, and it can help with any disease. So.
Okay, so for treatments, the goal purpose is to like relieve your symptoms since it is not reversible and possibly like slow the process down of COPD. And overall like improve their quality of life because living with this condition can be very taxing for a number of reasons we'll talk about later, like in the biopsychosocial aspect of it.
So some treatments and side effects of COPD our pulmonary rehabilitation can include a special exercise or activity plan that is set up by the nurse or doctor to be able to strengthen the muscles, and it's used to help your breathing as well as just like improve your strength and everything else. So they also have breathing strategies that you can do, so like with the spirometer that we saw earlier, and they have psychological counseling because biopsychosocial model, it's going to affect your psychological health as well. And there's also COPD education that the doctors will give, like pamphlets, and they'll talk to you and tell you like what your life is going to be like with COPD.
So the picture was kind of like what the doctor was talking about in the video, where you like feel breathless and then you avoid all the activities that you usually like enjoy because you can't breathe, and you do less and you get more breathless, and that's like the process of them becoming like depressed, and what she said that they can't do like things on their own. So by like doing this treatment and therapy, they're less likely to feel depressed because of that.
So some more treatments and side effects. Various medications can also be necessary, and these include things that we have talked about previously, like the bronchodilators and the spirometers. And then steroids can reduce the inflammation that a person gets in their lungs. Antibiotics can treat respiratory infections as well as any other infections that you could get, like because of COPD. And then vaccines for the flu and pneumococcal pneumonia, because those two are the main ones that affect your lungs. And so if your lungs are affected by those and COPD, you're going to have a less likely chance of living. And then you can also get some supplemental oxygen in a few cases.
Okay, I also just thought about something. Don't they prescribe you like steroids when you get like even like acute bronchitis? Isn't that how they treat it? Does anyone know? Because I just thought, is it? Okay, I just thought about that and was wondering.
Sometimes it's in the inhalers as well.
Say what?
It's in the inhalers too sometimes,
Yeah.
like with the bronchodilator, sometimes they have steroids.
Oh, is it really? Okay, well, that leads us to the next slide, which is bronchodilators. This medication like relaxes the airways and helps them be able to open up because they are like constricted. Obviously this will make it easier for you to breathe and get oxygen from your blood to your heart to pump and everything. Apparently they last like 4 to 6 hours and are used as an as-needed basis. So that's pretty cool. And then also there is supplemental oxygen. My grandma actually had this, so I like know how to do it on myself, which I thought was really cool. I felt like a nurse when I did it. But the air sacs in your lungs can become like damaged and destroyed, and again, it's like hard to pump the oxygen throughout your body and like get it in and out of your lungs. So typically when it comes with this machine, it comes with like a nasal cannula, which you will see on like the following slides. It can also be used with like a face mask at night. Also, sometimes they do like surgery procedures to like get the airflow directly into your trachea if like you can't do it yourself. So the oxygen actually like boosts your energy and I guess like willingness to exercise and like be active with friends and family and stuff like that. It also improves your mood and sex life apparently. And it lowers your chance of heart failure because it is helping that oxygen pump to your heart. So.
Plus with the pump, you're getting like the pure oxygen, not like the nitrogen and everything else, and also the toxins that were in the air like we talked about
Yeah.
before.
And they can, like the doctors prescribe how much oxygen too, because it's not like 100% pure
Yeah.
oxygen. So,
But it is a lot better for you.
yeah.
So these are just some of the devices that we were talking about on the last slide. The mask is what you would use at night with your sleep apnea to help you breathe and to be able to get oxygen at night. And then the nasal cannula, you would use that during the day if you just have like oxygen problems throughout the day and you need your machine to be able to live.
Has anyone like seen or used a CPAP or like tried it? What is it like to you? Is it like, because I think of one thing when I think of that, it's like really loud. Is it loud when you guys use it? Okay, so that's like also something that we'll talk about later with the biopsychosocial method, but that can be really hard for people transitioning into that to like sleep in general, let alone help with their sleep apnea.
The larynx is located and stabilized,
Warning, if you don't like needles, don't watch this.
ending the trachea from lateral movement. Locate the Adam's apple. Prep the area. Slide the index finger downward to locate the cricothyroid membrane. Insert the needle through the membrane, maintaining a 60-degree angle caudally, while aspirating the syringe. Once the needle has entered the trachea, air will be aspirated into the syringe, confirming that the tip of the needle is properly located. Advance the catheter into the trachea an additional inch. Remove the syringe and the inner metal needle, leaving the plastic catheter in place. Care must be taken to avoid kinking the plastic catheter. Attach the oxygen tubing or commercially available device and ventilate the patient by occluding the hole in the feed tubing with the thumb for 1 second, watching the chest rise. The hole should then be uncovered for 4 seconds to allow for expiration. Secure the catheter in place with tape. The catheter must continually be stabilized manually and observed for kinks.
I
The
apologize.
larynx is located and stabilized.
Alana, because I saw your, you did not like watching the needle.
Oh, you're okay. It's okay. I have to do it by Monday, so.
So some of the preventions for COPD, smoking, that is the biggest cause of it. We talked about how 8 out of 10 people, that is the cause of their COPD. So quit smoking and you can prevent it even further. And then also avoid tobacco smoke and other air pollutants. So that goes along with the secondhand smoke that we were talking about. And you just need to get all the smoke out of your life.
Okay, let's give them a second to write down everything. But we have an activity, so if you wouldn't mind like standing up. And so this will give you a little bit of a picture of what it's like to live with COPD. And the type of breathing strategies that they are taught to use on a day-to-day basis. So I'm gonna do it too.
Disclaimer alert, disclaimer alert. Hey everybody, it's Dr. Joe. Today I'm going to show you some pulmonary breathing exercises for things such as COPD, or just to increase your lung capacity if you're a swimmer or if you're a surfer and you want to be able to hold your breath for longer. So let's get started. So with the breathing exercises, you want to always inhale through your nose and exhale through your mouth. With your mouth, you don't want to make cutesy face, but you want to purse your lips when you're breathing out. So the first thing you want to do is breathe in through your nose for 2 seconds, and then you're going to purse your lips and then blow out for 4 seconds. So pretty sexy, huh? Now, just do that about 10 times to get the oxygen flowing, and then you're going to start making some movements with your arms to loosen up the muscles in your chest area as well. So the first one, with your arm moving, bring your hands into clasped in front of you, and you're going to actually move at your trunk. So you're going to take in a big breath, and then while you're doing your movements, you're going to breathe out. So big breath in, and out. Keep doing that as long as you're breathing out until you get to the end of the level, and then do that 5 times. After that, then we're going to do the chicken wing. So bring your arms up to your shoulders and same thing. Big breath in through your nose. And while you're breathing out, makes me feel like I'm at a wedding doing the chicken dance. Now after all that's nice and loosened up, you can try some breathing through your diaphragm. And that's actually breathing in the stomach area instead of your chest area. And a good way to know that you're breathing with your diaphragm is put your hands on your stomach like this. If your fingers aren't moving back and forth, then you're breathing up in your chest area. So try and make your hands move. Did you hear that noise? Somebody must be hungry. Same thing, do that about 5 times. And then the very last thing is a very interesting, kind of embarrassing one. My brother claims that guys can't do it, but I think it's just because he can't do it. So what you're going to do, this is going to be a forceful breathing out. And what you're doing is you're just trying to get all the air out of your lungs, even in the reserved area. And then once you forcefully get all of it out, you're going to hold your breath and kind of suck in. And it's actually going to make a little dimple here. So if you're doing it right, it'll almost feel like a vacuum in your throat. So you're going to do this. Breathe in and blow out. And just hold that as long as you can. When you let go, it'll make a really interesting kind of suction noise. And that's getting all of it out. Hold it as long as you can, but since you're on the breathing out, it probably will only be a few seconds. Woo! After all that holding and breathing, I feel like I'm going to pass out. I hope you don't feel like you're going to pass out. If you have any questions, leave them in the comment section. If you'd like to check out some other videos, go to Ask Dr. Joe.
Okay, you guys can sit down. Thanks for doing that. I didn't know she was that funny. I guess I didn't pay attention as well this time. But how did you guys feel after doing that?
Do you feel like you can breathe better, or?
I feel like I'd definitely breathe better later if I did those a lot.
Yeah. How would you feel if you had to like do that in public, like around people you maybe not even know?
I wouldn't do it.
You wouldn't do it? Yeah.
Especially that last
Be like,
one.
Yeah.
yeah. Oh. I guess that's right. Okay, so this is our discussion portion. So I guess it's already up there, isn't it? Oh well, it's okay. So in what ways do you think that having COPD would affect people you may know or yourself if you were to have it? It's up there, but like, what do you guys feel? What do you think? Yes.
Oh, were we
Somebody-
supposed to read
No,
this,
I don't
or did
know.
we just talk?
Yeah, it's
Go for it.
Oh, okay. So my grandfather died from COPD, and like a lot of the time, my grandma would always want to travel, but he wouldn't be able to like travel far because he would have to carry his oxygen tank, and then like the whole like yeah. So it was just a lot if like he wanted to travel. So this is really good.
Oh, that is a good one. Especially like even eating out with your family or, you know.
Just imagine having to carry like an air tank with you wherever you go.